So thank you, Rob, so much for joining us for this podcast. We're really excited to chat with you and really excited to dive in. Can you quickly give everyone just kind of quick introduction and a bit of your background?
Yeah, my name is Rob McLin. I'm the CEO of Good Samaritan Hospital. We're located in Vincennes, Indiana, which is southwest Indiana. We're about an hour north of Evansville, which is the largest city, and 2 hours south of Indianapolis. So we're in that southwest corridor. I've been with Good Samaritan for 30 years and started as auditor and moved into the CFO role and did it for 13 years, and now have been the CEO for the last 12. So it's been quite a journey, and it's been an honor and a privilege to be part of this organization.
Craig, I had Rob already kind of do a quick introduction, and we'll want to catch one from you as well that we can kind of edit in some intros. So can you give us a quick introduction on yourself and your background?
Yeah, sure. I'm Craig Richardville. I'm the Chief Digital and Information Officer at Intermountain Health. Prior to that, I was with SCL Health in a very similar role and came to Intermountain as part of our merger. I spent 21 years at Atrium Health based out of Charlotte, North Carolina, and 11 years prior to that with ProMedica Health.
Awesome. Well, thank you both so much for joining us today. We want to start kind of at the top. So really understanding what are the strategic priorities for your organization today and how are those progressing? So Rob, why don't we start with you as you're thinking about your organization and looking out kind of 12 months, what are the really kind of top hitting priorities for your organization today?
Yeah, from a strategic priority standpoint, those really haven't changed much before and after COVID. So our top three are always going to be growth and stewardship, which is kind of we count that as one. And just as a reminder, we're a standalone hospital. So we're the largest employer in our county, but we're a standalone hospital that's a regional hospital for 11 counties in both state of Indiana and going into Illinois. So we're going to be a little different in our approach to things and don't have much of a safety net when it comes to a lot of decisions we make. But so number one is growth and stewardship. Number two is patient safety and quality. If you don't have that as a top priority strategically to maintain that world-class safety levels and quality levels, you're not going to be around. And then finally, our third one in equal to the other two is engagement and experience. So we kind of tie those together because if I will not have good patient experience if I don't have highly engaged employees, staff. And so we've kind of worked those together and said, hey, we want to be a 5-star organization. And the only way to have that is you've got to have 5-star engaged employees, caregivers, and you've got to have an experience that the patients feel like they've had their experience exceeded based upon their expectations.
And there's a lot of inputs, Rob, that likely go into those strategic priorities. From an IT lens, what are the tools and resources that are supporting those initiatives that you're looking to?
Well, that has changed a lot. So from a strategic standpoint, one of the things that pre-COVID, this is an example, we're a smaller hospital, but pre-COVID, we were doing about 100 virtual doctor visits a year, 100. As soon as the pandemic hit in the year 2020, we went from 100 to 3,000. And we kept 3,000 virtual visits in both 2020 and 2021 and have seen that rein back a little bit in 22 where we're going to run about 2,000. But to have the capacity in our area to be able to do those virtual visits has been probably the biggest eye-opener for us. That really did change dramatically. That was not high on our list of priorities when we looked at here's what we're going to be able to do going forward to maintain growth and to maintain quality and to maintain better patient engagement. I mean, that was not a thought when we were doing this pre-pandemic.
Yeah, that definitely, I think, shifted focus, priority, and where spend was kind of being funneled. Craig, from your perspective, and obviously kind of a different type of setting, different type of healthcare organization, how have your top priorities shifted as you're kind of looking out the next 12 months? What is really the top priorities for your organization?
Well, we have what we call a strategic framework, and that framework has been vetted up and down through our organization and through our board of trustees. And with that, we actually have six, very similar to Rob, and I think many of us within the healthcare industry have very similar types of priorities. How we get there and how fast we can get there and our success of being able to execute against these priorities is really what will, I think, differentiate many of us. But our first one is the fundamentals of care, the quality, safety, all the things that are all around the care experience. The second one is to have the best consumer and caregiver experience. So this is getting us a lot more into the digital aspects of the new work, but it's not only focuses upon our consumer, which is also our patient. We also have a health plan, so it's members and those that have yet to make a choice of where they want to receive services, but also our caregiver experience, which is our employees or associates. We call them all caregivers. So we want to have that best experience for them. We want to not only develop future clinical models, but to deploy them and to be able to share them across the industry. Part of Intermountain Healthcare's history and future is really to impact the industry in a positive way. That leads us into our next one, which is accessibility to our services, affordability to our services. And many people call healthcare very complex. So part of us is to make it simple and seamless with that access. Health equity is our fifth one, very important, and is similar, like many others, growth, and not only in terms of breadth, but also depth and the penetration of the markets that we serve. We are currently in 8 states up and down the Intermountain range, but also the intent is to take those services to what was mentioned earlier regarding telehealth, telemedicine, and be able to spread those nationwide and really have an impact upon those that we serve.
So similarly, from an IT standpoint, from an IT lens, what tools are really standing out to help facilitate and propel that strategy forward for you?
Yeah, there's 2 things that I think right now that we expect to differentiate us. One is data, is to be able to have access to data both in and outside of our system, to be able to have meaningful uses of that data, put that in the hands of our caregivers, also in the hands of our patients or our members. Also on the digital side, digital will be a differentiator for us to be able to automate a lot of the services that we are providing, to be able to move things into more of a self-service model. So I think one of the most underutilized resources we have in healthcare is truly the patient and or the member themselves, and to be able to provide them those self-service tools so that they can take some of that lower hanging fruit, have us automate that, give that to them in an app, put it in their pocket, allow them to do a lot of the work where right now we require access into us for those types of services. Many of us have seen that, in our personal lives with retail and banking. We all used to go to a branch. We all used to be in the drive-through. We all used to stand in line. And now none of us do many of that, even the retail side. We put them all in very simple, easy to use, put boundaries around it, guardrails so people can't get in trouble, but also, do it so that I can do it at any time I want, at any location that I want. I just pull out my phone and I can do it at 3 a.m, just as easy as I can do it from 8 to 4. So I think for us, part of our obligation to put that data into the hands of our patients and members is an important differentiator.
Yeah. And I feel like that consumerism conversation, we've seen that come up a lot, especially through the pandemic, around kind of the ease of navigating the healthcare system, payments, all of that. Rob, I'm curious from your perspective as a standalone hospital, where does that priority fall? And is that something that you feel like as an organization you can prioritize, or are there other things that kind of trump that today for you guys?
No, that's really important. I mean, that is absolutely, as Craig said, that's critical. And what we've seen really over the last couple of years is we're an Epic shop. So we utilize Epic. And so the push toward more utilization of MyChart has been huge and really pushing the people out. We're a small community, so we've got 18,000 in our city. We've got 36,000 in our county, and so we do a population of about 250, and these are older people. So these are mostly predominantly Medicare, and you think, well, they're never going to get it. Well, the reality is they're pretty sophisticated in their own means. And like Craig said, I don't think any of them want to wait in line anymore. They'd much rather do this electronically. So the use of MyChart, we do a lot of self-scheduling now, and we're growing that self-scheduling for our physician offices. Remote bill pay has been huge for us and has grown significantly. Telemedicine, I've already mentioned, has been a big deal. We're moving into virtual nursing, and I'm not moving into virtual nursing because I want to lay nurses off. I'm going into virtual nursing because I don't have enough nurses to be able to hire to be able to staff the way I used to staff. And that change in mindset is dramatic in what we're going to have to do as a small regional hospital. We're just not going to have the swings at the plate at bringing people in. So you're going to have to use other means. And that virtual nursing is really a huge opportunity for us. And then the other thing that was an eye-opener for me, because I've just always come to work. I've always been in the office, and we've always had our offices full, is the amount of people that we can utilize remote working. We can do that so much more than what we've done in the past. And I was one of those ignorant leaders that said, oh, you'll never be productive doing that. They're going to sit around and they're going to sit in their underwear all day and watch cartoons, and they're not going to pay any attention to work. And what I found out was they're equally, if not more productive, because they just don't have any stops. They can come in, they can work when they want. If they want to get the kids off to school, they can get up early. If they want to do something late, they can go in work later. And it's actually been a huge eye opener for an old fogey like me. And it's been a nice thing to see. Yeah.
Absolutely. Rob, you touched on something I think that we're hearing a lot of right now, which is the staffing challenges. We hear that especially around nursing. We've also heard, some concerns around IT departments, kind of getting poached by other industries, et cetera. You mentioned virtual nursing. What other, solutions or approaches are you looking at to help address some of these staffing concerns, whether it be for nurses or in your IT department or other areas?
Well, for us, we're looking at different outsourcing opportunities that don't break the bank. So one of the increasing costs that we are seeing is the cost of utilizing travelers. Well, that's not sustainable for that's not sustainable for any hospital, let alone for a small regional hospital like us. And so what we've tried to do is, one, make sure that we're extremely competitive on our local wages, that we are competitive with our peers in our region. So our main competitors are an hour away, and that's what we've got to make sure that we're focused on. And then a lot of opportunities to be able to utilize other services that are reasonable in price that allow for some of that outsourcing. We heard in areas like lab techs, ultrasound, radiology, all those areas above and beyond even what the pain has been with regard to our nursing. And so I think the use of virtual in a lot of those areas is going to become more and more of a priority for us to look at, because I just don't see the markets opening up as quickly as we're going to need to make sure that we've got the right staffing levels to accommodate our patients and provide world-class care.
What about for you, Craig, at Intermountain? How are you guys tackling some of the staffing concerns that we're seeing today?
Yeah, in terms of the technology, certainly there's a lot of other things around pay and benefits and things of that nature that everybody's using iFlex programs and things of that nature. But, for us, in terms of the technology piece, there's several things. One is, we are doing a lot of work around intelligent automation, so robotic process automation, not only in the back end areas, so the places like supply chain and revenue cycle and HR, but also on the front lines or close to the front lines. Part of the burnout issue with some of our providers is some of the supporting staff not able to bring them into the organization. So a work of a nurse may now include a little bit more of the dietary services, a little more of environmental services, a little more of security, maybe a little bit more of IT and helping people get access to either the tools in their rooms or their TV, et cetera. So part of what we're doing is focusing upon those areas as well. How can we limit the amount of labor impact that we have such that that work isn't offloaded onto some of our hands-on caregivers and then get back to the core work of which they're licensed to do, and not all the auxiliary work that kind of goes around it. Another thing that has been beneficial so far in our pilots, and we're actually getting ready to expand it out by the end of this year, is the ambient intelligence, the actual interpretation of conversations between a provider and the patient, such that it reduces documentation for the provider, allows him or her to have a better work-life balance. It actually is more accurate in many cases than when the person was documenting it themselves, either after the visit or in the midday or at the end of the day. And that also has a revenue impact, because now being more accurate actually is a little bit more acute types of services that they were performing versus maybe what somebody recalls when they go through the documentation piece. And I think that whole artificial intelligence is a very open environment for us to be able to continue to put those tools, as mentioned earlier, in the pockets. If we can automate, as we start to transition from the art of healthcare to more of the science of healthcare, that science stuff can be automated, can be put in the hands of the right people, allow some of that lower level work to be done, which then creates the opportunity for people to be with more acute or higher tertiary care services. With that, though, comes the challenge of, if that's all I'm seeing all day, that may burn me out too. Yeah, I don't have anything that's easy. It's all complex chronic patients that I'm seeing. So we've got to make sure we understand how we balance that whole work life, the responsibilities of the job, and who's doing the work. But whereas possible, the whole intelligent automation, the artificial intelligent work, we need to put that to use a lot more often and accelerate that work. Again, going back to things that we do today, our GPS is that way. When you watch Netflix and it gives you the things that you want to see next, give it on your viewing history, all that kind of stuff. We have access to so much data, and putting that data to use and making that part of the digital environment that we're creating is a big part of our future.
And it's really you're touching on some of these really innovative areas that are, I think, looking to kind of be that transformative next step. I'm curious from your perspective, in the study that we just published with Bain, looking at the specific segments that rose to the top in terms of priority. It was things like revenue cycle, patient flow, cybersecurity. I'm curious your thoughts on seeing those kind of rise to the top from the group. Does that resonate with you? What are your thoughts on those three? And how does that compare to kind of how you're thinking about some of the priorities in your organization?
Yeah. Are you asking me?
Yeah, go ahead, Craig.
Oh, okay. So the one thing that we have that many don't have, but more continue to have, and you saw with a couple of announcements this week, is the M&A work. The merger and acquisition work. We've had several major acquisitions over the last few years. A major merger, 7 months ago. So integration, bringing us together as one system, is a top priority for those that are in the M&A type of activities. For those that aren't, then obviously they don't have that body of work. But there's a lot of returns that happen within integration. Stewardship was talked on earlier. The rationalization of our work, taking best practices among several different entities and creating one best practice to spread across them all. That benefits certainly the whole organization and the communities that we serve. So integration kind of rises to the top for us. And that also revolves around interoperability. We're not a single application or a single EMR healthcare system. So we have to create that unification for both our providers as well as our patients or our members, so they have a single view to access of data that's coming from multiple sources. I think that's a core competency that will help us in the future and help others as we share that out, because many communities do have multiple, whether it's single physician or other groups in the communities if they're smaller, or other hospital systems or health systems that have hospitals where there may be several made. The interoperability piece continues to be an area of focus, and we plan to solve that. We do have an Impact Intermountain initiative, which has to go with really driving out the cost. We want to make sure not only the access, as I mentioned earlier, to our services, but that they're more affordable. in order to make it more affordable, we do have to drive costs out. Certainly the labor market that was mentioned, the inflation that's happening now in our economies across all, those are also accelerators to have us continue to focus on affordability of our services while maintaining and also increasing the high quality that we do provide. So that value proposition continues to rise as we move down the road. But in terms of, what is people being seen in terms of like revenue cycle, those are opportunities that we talked about earlier about the back end automation. There's a lot of manual aspects that go into that. There's a lot of data. There's a lot of engagement with patients that go into that, or those that are responsible for the bills. So as we can automate a lot of that work, I think we all saw with the pandemic, within a matter of months, and for some of us, a matter of weeks, we moved from a very high labor of how we contact and engage to automate. We had symptom checkers out there. We had people self-scheduling their appointments. We had, for the vaccines or for the testing in the early days. There was a lot of automation that took place where we had tens of thousands of people in queues and used Salesforce and other products to do all that calling for us, where historically it was mostly people doing a lot of that work. So I think some of that back-end automation type of work that we've learned in the pandemic, to apply that to all of those, like all call centers are all being called contact centers. The call is actually like as the last resort, using chatbots, using voice bots, using self-service, all predecessing so that the machine can do the work without a human intervening. When it gets to a human, which in many cases it will, in some cases, maybe even more frequently with some of the complex patients, but that becomes a failure point for us. How can we automate the intelligence that the human is using to solve that problem for that patient so that the next patient that contacts us, that can be automated for them? Then they can do it at 3, 4, or 5 in the morning or middle of the day. It really makes no difference in terms of when they do it, and the quality of service will be consistent going all the way across.
Yeah, and you bring up a great point. As RevCycle rose to the top, thinking about labor shortages and really looking to automation and looking to some of those tools that can really offset the need for FTEs there. Rob, what about from your perspective as you think about those three that came out in the top in the study, how that relates to your organization and your thoughts there?
Yeah, they would be our top three as well. Revenue cycles for a small hospital like us, it's all about the ability to be able to collect. And there are so many impediments in the way of being able to bill accurately, bill timely, and collect timely. And so for us, it's all about the collection process. It's about automating as much of the pre-cert process as we can do, automating as much of the self-pay online. When you look at the work that has to be done from a central billing office standpoint to just get a bill out the door and then cross your fingers and hope that it's accurate enough to get through the payers without having it denied 17 times, there are a lot of steps associated with that if we can work with our payers and work with those different organizations to say, look, how much of this stuff can we automate so that there is no confusion whatsoever about what you're willing to pay, what you're going to pay based upon the contracts that we have in place. And we'll get that information into the system more timely from a patient perspective so that we limit the number of times where you have to kick it back. And that, I mean, we're an organization of 1,800 people, and I have 60 individuals that are designated for nothing more than covering all of the administrative overhead stuff. That if we could minimize those type of things, I wouldn't need that level of overhead. And it's frustrating, yet it's a mandatory thing, because if not, then my revenue flow goes to zero. So that's a really big deal that we're focused on. Secondly, on the patient registration area, we're working into areas like having our own kiosks so that we minimize the number of times that a patient has to come in and see somebody in person. Let them do that through the kiosk. Let them do that through pre-reg. Let's get all of your information in. If anything has changed, get it changed before you even come into the appointment that day, so that we can ask the question, has anything changed? Did you get it all in? If so, we can move you in and be much more expeditious in getting that patient through the system on a timely basis. Something we haven't talked about, which is a huge deal in Indiana, is price transparency. So we have spent a ton of time and effort on making sure that the transparency to the patient on, all right, what's the cost? What's the cost of that procedure? What's my out of pocket based upon the information I'll share with you as a patient on who my payer is? And then we get a better feel for, okay, your out of pocket is going to be X. Let me also share with you how you can pay that online and not even have to worry about the headaches of waiting in line or going through our central billing office. All those are really critical. And then the last piece that you mentioned, which I would have never even thought was going to be an issue in a little small town like Vincennes, is the cyber. The cybersecurity keeps me up at night, and I would have never guessed that 3 years ago. I just wouldn't have. And now it's at the top of our list of things that we have to make sure not only that we're protecting ourselves, but we have the things in place to provide those automated protections so that I can even get insurance. Because the biggest fear I have is not that I'm going to get hit, because I think invariably we'll all get hit at some point. It's more, will I have the coverage necessary to be able to bring this thing back up without burying the organization because I couldn't even get insurance to cover it? And that is a big deal in a smaller organization like Good Sam, where you see more and more fewer options available for insurance coverage on cyber. It's just amazing. And so the technology that needs to be put in place, even in small organizations like our own, to assure that we're minimizing the risk of that kind of attack is absolutely imperative. And I'm learning that very quickly.
Well, as we wrap up, I want to just close with one final question. Really looking at, and we touched a little bit on this with labor shortages, et cetera, but as we look at the macroeconomic environment that we're in, amidst, in recession and have these kind of concerns in front of us, how has that affected your approach to spend and investment? And has anything shifted on you in the past couple of months? Craig, let's start with you.
Yeah. Things are shifting constantly. So even the last couple of months, the last couple of days, even like this morning, I was in a meeting and discussing with certain members of my team as we go in front of a larger working group in the future, all the other types of nuances that need to go into that business case analysis to make sure that we totally understand the complete picture, the options that are out there, those that will have an immediate impact, those will maybe have a longer term investment. Yeah, I think that's probably the word that I would kind of chime in the most. We're going to have a tough couple of years. Everybody, the whole industry is. And there'll be several of us that hopefully will be able to survive it a little bit better, a little more cross coverage, wider range of markets to serve. So we've got that kind of, plus we have a plan which creates another opportunity for us to continue to move forward in a more diverse manner. But the investments that we're making, we can't hold back on the investments because they will pay out in years 2, 3, and 4. The question is, over these next couple of years, how do we make sure that we continue a very positive operating margin, impact, contribution, continuing to increase, because the competition, makes us better. And we want to continue to be able to compete for the services, for the right to provide those services, and others compete against us so that we can continue to improve what is happening among the industry. But we have to also invest. And I think when we look at the data piece and we look at the digital piece and we look at some of the intelligent automation that can take place, these are things that are newer within healthcare, but they're not newer, across the globe and across other industries. And many of us not only do that in other spaces, like I mentioned with banking, retail, we actually expect it. So I think in order to win the game, to be able to make access easy, making your services affordable, having a high valued product that you bring into your populations, those are all things that don't have a payout maybe tomorrow, but they will have a payout in the future. So I think that balance of making sure that you can continue to progress in your markets while building what the future is supposed to look like. I mean, part of this future is not for me, but it's for my children and my grandchildren. the transition from volume to value will have a huge impact upon how we deliver services, how we provide the services, how people access our services, how affordable they are. And by moving a lot of that work, getting rid of the waste that's within healthcare, some of the comments that were made, by Rob about some of the waste and some of the bureaucracy that's in place, creating more a collaborative industry. So cybersecurity is a great example of that. It hasn't changed for us because it's been a priority for us for years. But why can we not create a collaborative of others that may not have that luxury and share that? That's not a competitive advantage that somebody gets breached and somebody doesn't. Nobody wants that to happen to anybody. It's just a high risk that hurts people and populations. So why can't that be something that can be shared across the industry, certainly within our own regions or markets, but why not share that across? Why can't Rob and I just kind of say, hey, here's what we do, how we do it, can help you provide that service at a higher level, at a lower cost, so you can get the assurance that you need and at the rates that are digestible. So I think there's a lot about collaboration within the industry. Some of the newer people coming in, I think is exciting when you look at some of our tech companies, because we are becoming tech companies that deliver healthcare versus healthcare that has kind of tech on the side. And the evolution of Rob and I and others over the last couple of decades has moved us from being an expense, over to being part of workflow and operations, over to being a strategic asset and a strategic weapon to be able to use to differentiate our products and services, not only among our markets, but hopefully expand that across the whole industry. So a lot of change coming up, and I hope we can continue to invest in what the future is going to look like.
Yeah, definitely lots of transition period, I think, for a lot of aspects of healthcare. And amidst, I think, coming out of this pandemic, facing recession, so it feels like there's a lot of variables working against that transition, but can also funnel and I think demand the change, put us in a position that allows us to evolve. Rob, from your perspective and your organization, how would you say the current macroeconomic environment is affecting your approach to investment spend, and how has that shifted on you recently?
Well, the shift has been down, and it's been rough. I mean, it is. When you're standalone, the investment bucket that you have available from a capital standpoint, and with the margins down to virtually nothing, it shrinks that investment capacity. And one of the things that we've committed to is that from a technology standpoint, we're not going to shy away from that. We feel like, I kind of term it from my old CFO days, I want every bit of technology capable within the organization, but I need a legitimate return on investment. I can't have these soft dollar investment returns that they go, oh yeah, well in 12 years, you're going to be lovely. I mean, it has to be financially driven for us to be able to move in that direction. So there needs to be very minimal soft dollars and literal dollar for dollar return on our investments for us to be able to move in those directions. And so we've really forced that. I think one of the things that Craig said that is probably as profound as anything that we've talked about today is that art of collaboration. And the fact that we as a standalone are fiercely independent, but independence doesn't mean isolation. And so we have been working with the systems in Evansville, which are an hour south, and systems up in Indianapolis, 2 hours north, and understand that we've got to be able to work collaboratively with them, learn from them, share information, let them share with us and us share with them. Because even though we're small, we do some things really, really well. And there's some things that they can learn from us as much as we can learn from them. And so the opportunity to be able to do that and collaborate and share, like Craig said, with regard to how we're doing cyber and what opportunities might exist to be able to limit that. You're right. I've watched it amongst my peers. I've watched individuals hit with cyber attacks, and there is nothing good about that. There is nothing to revel in as a result of your counterpart being hit and you not. So we need to work together a lot more intensely if we're going to be successful. And the last thing I'll say is as we go forward and keep investing is that my mindset will always be that we must continue to grow, that you got to continue to move forward and you got to be thoughtful in your strategic planning. And it's probably no more critical to think through your strategic plan now when these times are tight this is probably the most important time to be able to really focus on that, because you don't shrink to success. All right, you're never going to minimize yourself into a greater end result. And so the growth has to be one that's thoughtfully brought through a process from a strategic standpoint, and it has to be one that you can't just be in isolation. You are going to have to work collaboratively with others, regardless of whether you're independent from a licensure standpoint or part of the large system. And I don't think that changes the perspective from either of us. And I thought that's a great point that Craig made. I think collaboration is going to be critical for all of healthcare if we're going to succeed and survive going forward.
I do want to comment on one thing that Rob said that I think is extremely important and many people overlook. So back when I was at Atrium Health, which was Carolina's healthcare system, we were 3 to 5 hospitals when I got there. And over my 21 years there, we were 42 when I left. And so as we went through that growth stage, and now here at Intermountain, just continued growth again, what you find when you find a gold nugget with a small system or a small hospital that's now part of your system, and you can spread that, from 1 to 3 hospitals to 30 or 40 hospitals, the return is like 20-fold on that investment. If I take something that we're doing and be able to hand that to a new addition to the family, the return is like 5%, 3%. So the returns, when you find somebody like Rob who has a different perspective on how he sees things and be able, in many cases, do some things, better, faster, and cheaper than some other organizations. If I can take one of those nuggets and spread it, it's a huge return for larger healthcare systems. So I never discount the size of any hospital or healthcare system, because I hope there's things that I can find and that I can spread really quickly across a larger entity.
Thank you, Craig and Rob, so much. This has been such a fascinating conversation, and the unique perspectives that you each bring to this conversation as we're navigating a lot of transition, a lot of change, and a lot of demands on the healthcare in our country today. I appreciate you both so much for chatting with us today, and really striving, both of you, to bring great healthcare to your communities. And so thank you so much for joining us today.
You're very welcome.
Thank you.